Magandang araw po sa inyong lahat. I would like to thank the Philippine AIDS Council for hosting this very important event to commemorate the World AIDS Day with the theme Global Solidarity and Shared Responsibility. I am honored and privileged to speak with you today. 2020 has been a challenging year for all of us. But despite of these challenges, we opened opportunities to do things differently, moving together towards ending AIDS. To start, for every 100 adult individuals, one is high risk for HIV. For every 100 high-risk individuals, 9 are HIV positive. The HIV epidemic in the Philippines is rapidly increasing. The number of new infections increased by 214% from 2010 to 2019. Now, with the continuous rapid increase in the number of new infections, it is estimated that there will be more than 111,000 Filipinos living with HIV by the end of the year. As of October 2020, 81,000 individuals have been diagnosed. Of these, 6,300 were newly diagnosed this year. Of the 81 cases, half were aged 25 to 35 at diagnosis. Meanwhile, 29% were young people aged 15 to 24 years old. Sexual contact, or 96%, remains to be the predominant mode of transmission in the country. Most of these, 80%, were men having sex with men. Let us now then take a look at the geographic distribution of our diagnosed cases. Greater Metro Manila regions consisting of the National Capital Region, Calabar Zone, and Central Luzon remain to have the highest number of the reported HIV cases, which contributes 63% of the epidemic in the country. The HIV care cascade is a measure to assess diagnosis and treatment coverage among people living with HIV. As of September of this year, 68% have been diagnosed, and among those diagnosed, 60% were on treatment. These are the people living with HIV that need to maintain on treatment. Only 16% were tested for viral load in the past 12 months. Viral suppression among those tested in the past 12 months, on the other hand, remain high at 96% among those tested. Gains across the cascade was a collective effort from the government, local government units, community partners, and non-government organizations. However, the National HIV Program was not exempted from the effects of the COVID-19 pandemic. The pandemic affected the delivery of HIV-related services, particularly in testing, treatment, and access to antiretroviral drugs and other commodities. This was reflected in the reported diagnosis and enrollment of HIV cases in the HIV/AIDS and ART Registry of the Philippines. During the same time period in 2019, 9,700 individuals were newly diagnosed with HIV. Meanwhile, in 2020, diagnosis decreased to 5,600. Similarly, enrollment in antiretroviral therapy decreased from 7,600 in 2019 to 5,600 in 2020. Limitation in mobility during the community quarantine decreased the availability of the HIV testing services outside the facility, such as community-based screening and outreach testing. In addition, uptake of the services in facility, both testing and treatment, was hampered by the mobility restrictions. These challenges may have had an impact on the testing and treatment flow across the country, which resulted in low numbers of total reported of HIV cases. We must interpret the data with caution and consider other sources of data before arriving such conclusion. Pero hindi po dapat ititigil ang pagbibigay ng serbisyo sa ating PLHIV. Lalo na ngayon, kailangan natin magbayanihan para mabigyan sila ng tamang atensyon at serbisyo. In fact, the crisis opened opportunities to do things differently. Community outreach activities were transitioned to online events. Differentiated testing, strategies such as self-testing, sexual and social network testing were explored. Patient-centered ARV delivery services such as door-to-door refills, telemedicine, platforms, and multi-month dispensing were adopted as well. Amidst the new normal, our goal remains to reduce new HIV infections in the Philippines from 214% increase between 2010 to 2019. We aim to reduce new infections to less than 7,000 by 2022. That's 56% reduction in new infections and thousands of lives saved from HIV. How will we do this? Halting the HIV epidemic is only possible if we successfully diagnose, enroll in ARV, and retain on treatment our PLHIV. In this diagram, the blue and orange are the PLHIV not aware of HIV status and not on life-saving ARV respectively. As of September of 2020, over 65,000 were not on life-saving ARV. Concurrently, protecting high-risk vulnerable individuals from contracting HIV is necessary. The same way we use for face masks and face shields to protect ourselves from COVID-19, we have strategies to prevent the spread of HIV. For all Filipinos, we need to educate with right information on HIV transmission, prevention, and available services. For high-risk individuals, we need to provide combination prevention in strategies including condoms, pre-exposure prophylaxis, and post-exposure prophylaxis. Bakit nila kailangan nitong combination HIV prevention? Based on the latest integrated HIV behavioral and serologic surveillance, among men having sex with men and transgender women, they start engaging in sexual activities at around 16 to 17 years old. But the practice of condoms starts 2 to 3 years later at around 19 years old. Meanwhile, only 1 in 3 men having sex with men and transgender women had comprehensive knowledge on basic HIV prevention and transmission facts. Only 38% used condom during last anal sex, and awareness of pre-exposure prophylaxis was only at 8%. To prevent HIV transmission, kailangan nila ng options to increase their defense against HIV. For people living with HIV, treatment as prevention to ultimately reach viral suppression, these ARV meds, if taken religiously, it can help suppress the virus in the body. Individuals who are virally suppressed are highly unlikely to pass HIV onto others, or what we call the U equals U, undetectable and transmittable. Let us strengthen our HIV prevention program for all Filipinos and key populations. Together, let us improve our testing and treatment services for PLHIV. Mula sa ating bayanihan, hindi lang buhay ng mga PLHIV natin na may improve, pero makakatulong din ito tungo sa pagkontrol ng HIV sa Pilipinas. This bayanihan cannot be achieved with DOH efforts alone. We call for multi-sectoral action to reach our goal of reversing the epidemic. Let us all participate in this call for global solidarity and shared responsibility. With that, thank you so much for your attention.